Good evening. My name is Jeff Robinson from Rahway, New Jersey. Besides being a county resident, I'm also a county employee at the Division of Social Services. I'm sure you're all aware that at the Division of Social Services, where we administer federal programs like Medicaid, TANF program, food stamps, some of the programs, in particular food stamps, are at record levels. All-time record levels. And that's not just in Union County, that's throughout the state, that's throughout the country, mainly because of the recession that we have found ourselves in. Workers at the Division of Social Services can barely keep up with the work now. You can imagine how it is on the floor with the workers just trying to keep up with all the work day after day. It's tough, but we're doing it. Well, come June 1st, 37 of our workers are going to be laid off. Trained workers who are right now dealing with clients from the county who come in and are seeking assistance for one of these programs, if not all of them. How do you expect our workers to continue to service the clients, residents of the county, to do the work, and to do it reliably and well? We can barely keep up now. You're cutting 37 more. It's not going to happen. It's not going to work. And here's the real ironical part. At a good portion of a lot of these county workers being laid off, not just from social services, but from Runnels and all the other parts of the county, a good portion of them are going to be showing up at social services applying for food stamps. So I think you guys got to go back and take a good hard look at that budget and see what you can do. Thank you.
I'm Barbara Egger. I'm the president of Local 5112, Health Professionals and Allied Employees. I represent the staff nurses, the registered nurses at Runnels. Been paying a lot of attention to what's going on, been looking at all your minutes from your meetings, and I have some comments and some questions. This is a good place, I think, to ask them, because a lot of times when I ask questions, I don't get any answers, okay? Are there any contracts for these departments that are being laid off? Are there any contracts that have actually been signed yet? If they have been, what are the savings going to be? How can you say you're saving any money if we don't know what the contracts are going to be and how much you're going to be spending, and how much you're spending right now in employee salaries and benefits? How long are the contracts good for? Are there any potential conflicts of interest with these companies and county administration members or politicians? And has any consideration of the new employment conditions of new employees has anybody thought about that? Are people going to be minimum wage? Are they going to be part-time with no benefits? This is very important. What are we going to do? What are we doing for our people? What are we going to be doing for our patients at Runnels? Another question I have is there any truth to the rumors that workers are being laid off and then being rehired in a different category, under a different name, to basically be doing the same job that they were doing before? I do believe that this may be happening, and I do believe that it's an end run around civil service and union contracts, and I don't think it's a very good idea. The members of HPAE, we pay attention, we look at your budget, and we're very concerned about the amount of money that's being paid by the county to outside legal firms, particularly when you're laying off employees now. I think that instead of laying off employees, you may want to give some consideration to hiring some more lawyers, because the money that's going out to private firms is unbelievable. And every time you come out with numbers, it's another 100,000, another 40,000, another 60,000, and it adds up. And finally, you guys have a lot of responsibility, and I don't envy you. But somebody made the decisions to do these layoffs, and somebody made the decision for each and every person. They said we would take this entire department, and then they took individual people. I would like somebody to take responsibility for deciding to pay the salary of an executive director of a nonprofit agency who's making more than $50,000 when she's only netting for the nonprofit $6,000 a year. Who's made that decision? Who made the decision that that person does not need to be laid off, that we need to keep that person on? when you're laying off housekeepers, and you're laying off nurses' aides, and you're laying off other people. Okay? Somebody made the decision. When I ask, it's always like this big somebody somewhere, or we made it. Who's we? Who is that? Okay, this is a disgrace. I'm surprised it's not a crime, quite frankly. Thank you.
Before we go on, I'm going to ask Kathy Hatfield to come up and address some of those things.
Thank you, Mr. Chairman. I think the one issue that I want to address is Ms. Egger was talking about, what exactly did you want? I'm trying to think of the one question that she had that was the contracts, right. Currently, we are examining whether there are certain functions at Reynolds that can be accomplished through privatization. The employees are aware of those contracts and those ongoing discussions. We are looking at certain contracts and responses that we've gotten from state contractors, but no decisions have been made yet. And we will be allowing the unions opportunities to bid on the work once we do have those contracts in place. And we expect that to be happening in the next couple of weeks. So, any other questions?
Good evening, Chairman Marabella, County Freeholders, County Manager, public at large. Thank you so much for entertaining our questions and our comments. We really appreciate it. My name is Tina Marie Lopez. I'm an Assistant Supervisor at Social Services and a proud member of Local CWA 1080. I do have a question. On page 44 of your proposed budget, there is an appropriation of $30 million for social service staff. Out of that appropriation for the 2011 budget, $543,000 was put into reserve as not used. That was the largest reserve out of any other department. We are the second largest department being hit besides our brothers and sisters at Reynolds. The question becomes, if we've handed you back the biggest paycheck, why are we taking the second largest hit? The other question that we have is that we ask that you respectfully come back to the table with us. Give us a targeted number of what you're looking for. Our membership vows here tonight to take voluntary furloughs to stop some of these layoffs. Our people will walk out of the door, young people with young children, with no medical insurance and no jobs. We are willing, I am willing as an assistant supervisor, to take a 3-week furlough, and there are several other members that will match that. Please come to us with a dollar amount and let's see if we can meet it. Thank you very much.
Good evening, Brandon Thomas Rawley, part of the Reynolds family. One thing's first, the comment that the young lady just made said the union coming back to bid on the work. About 400 years ago, we had a thing in this country called slavery, where a bunch of people sat around just like this and bidded on people to work. So that comment was just a little bit out of left field for me. All right. It was said to us at Reynolds that if this one company could not meet the standards of the money that they were looking to find or whatever, save or whatever the case may be, it was said that that would be out of the question. It would be off the table. This one particular company, this is a big international company that can do the job. Well, that company came back and the numbers weren't right. They don't know that. I know it, all right? It hasn't been taken off the table. Okay, find that a little bit odd, all right? Other than that, go back to my question when I asked the first freeholder meeting I attended, when are we gonna lay off the people that make the 90,000, sit in the back and do absolutely nothing, 150,000 or more, okay? Ms. Renner and her colleagues, they tried to answer the question for me. Wasn't right where I had it. None of the freeholders answered my question. I decided to do a little research on my own, and I pretty much figured out that not only you guys, but our hospital administrator is kind of scared to touch any of these people making this type of money. Because there's somebody sitting somewhere behind the scenes that is basically controlling this all and is saying, no, you can't touch them. I asked our hospital administrator at a meeting at our hospital, did she ever think about affecting any other areas, saving money in any other areas? She told me to contact my department head. My department head really has nothing to do with that. She has everything to do with the departments that are being affected. I question the judgment of my hospital administrator, Mrs. Wheeler. I don't think she thought the process out too well. We have the 3 departments that are being affected: housekeeping, laundry, and dietary. 95% of them are minorities: Black, Latino, Filipino. I find it very odd that we're being affected. Nobody in the nursing department was affected, which I can understand. They're in direct care with the patient, and the hospital is all about the patient. But the services that we provide for that hospital are very, very, very much needed. And I feel if a private company was to come in, the relationship between the employees and the residents will go totally out the window. We have residents there that depend on us for everything. It was said before, I'm a housekeeper, I'll go in there, I'll feed a patient, I'll wheel a patient down to the coffee shop, do little things like that. Private companies not gonna do that. They don't care. All they care about is the money, all right? I'm a lifelong resident of Union County, born and raised in Raleigh. I care about these people. There's a couple residents there from Raleigh who I know personally. I care about them. So I want to keep my job. And just like everybody else, we all want to keep our job. And we want to make things happen for the hospital. We want to save the hospital. So we're asking, what can we do as the workers to help save the hospital? I also asked Ms. Wheeler one time, did you ever consider asking some of the workers, asking the people on the ground floor, asking the ones that keep the wheels turning, any suggestions on what we can do to help cut this deficit? Okay? Never got an answer. And the last point I want to make is, as a housekeeper, all right, if I was to come in and mop a floor and I didn't put a sign up, somebody falls, breaks their leg, I'm held totally accountable for it. I'll probably either get fired or some type of disciplinary action would be handed down. We have a finance director that's been operating on an annual deficit of $14 million, like the county manager has stated in his last letter. We have a hospital administrator that is facing a financial crisis and that has no strategy or no idea on how to get out of it. Are they being held accountable? They're not being held accountable. And just for the record, the morale, of the hospital has gone down drastically. And it's partly because of the leadership of the hospital. It's pretty sad when the hospital administrator comes up to you in the hallway and says to an employee, how's everything going? Oh, don't worry about it. The private company will pick you up. They'll put you on board. That's a lie. Because the private company never got a contract. So the hospital administrator shouldn't be saying that to us. And just the other day, I'm fixing myself a cup of water. Hospital administrator asked me, how's everything going? I'm doing well. My family's good. My kids, they're doing fine. She told me, I feel like you're lying to me. I said, okay. So I asked her, any new developments yet? She told me no. Well, I just want to tell her tonight that I felt like she was lying to me. Okay? I'm sorry to direct this at you guys, but you guys are her superior, okay, the way I take it, the way I understand it. So I'm calling for an evaluation of our hospital administrator and our finance director. And before you go on with these layoffs, let's talk to them first. And let's take a walk around the 9 of you. Let's take a walk around Reynolds Hospital. Let's talk to some of these employees being affected. All right, find out what we can do to help, because we're the ones that actually get the wheels turning. All right, thank you.